Welcome back to Canadian Justice, where we're discussing the question of whether safer supply policies are actually making the opioid epidemic worse. Safer supply is when the government provides free drugs that have been tested for purity to people who are addicted to drugs. So, Adam, last year, Health Canada published a report detailing early findings from 10 safer supply pilot projects spread across 3 different provinces. And the report acknowledged that diversion, which is when people who have been given these safer supply drugs resell them to other people and use that money to buy stronger drugs, they acknowledged that that was an issue and stated that high opioid tolerance among fentanyl users was a top challenge. So if that is the case, if that's what the government has found, what have they done to improve the programs? I mean, certainly if they're aware of a top challenge, they're going to be doing something, right?
They're doing almost nothing at all, right? So during my investigation, I emailed Health Canada and asked them questions about diversion. And what I found was that Health Canada was woefully unprepared to deal with any critical questions about safer supply. Their responses weren't a credible plan at all, and in fact, in some cases, even made diversion easier. I forwarded their answers to about 10 addiction physicians, and those who responded were uniformly scornful of Health Canada's response. They called it bizarre, absurd, said it showed a woeful lack of understanding of the seriousness of the issue. And I think that, Health Canada just doesn't want to address safer supply in any serious way and critically assess the evidence base for that program.
If they're aware that this is a problem, but they haven't modified the policy to try to address that problem, are they doing any tracking to say, how much black market resale is actually occurring? How much is it impacting new communities that don't want to experience this opioid epidemic, or the impact of resale to black markets of these safe supply drugs on kids? Is there research that the government's doing to address that question so they can better improve the policy?
That research is not being conducted, to my knowledge. There's no serious attempt to measure the potential negative outcomes of safer supply. And what we need to understand here is that there's a level of politicization amongst the federal government and British Columbia's provincial government, but there's also a level of politicization amongst the researchers themselves. Addiction policymaking and addiction research is controlled by a small clique of researchers who are based out of BC, who are highly ideological and are basically advocating for radical drug libertarianism. I can't go into too much detail because some of this will be covered in my future reporting, but there's a shocking amount of data manipulation and questionable practices in that field that lead many to believe that our addiction policymaking is not actually based on evidence, it's based on ideology and, I guess, falsehoods.
So I think the most important piece of research would be not just about diversion, I think that's crucial, but about whether or not this is actually saving any lives. Because I understand that ideology can be a problem in this field, but I don't think anyone's coming to this with a bad intention. I think the intention of everyone in this field is probably to save lives. So what research is there being done about how well this is achieving that goal?
So the research that is supporting safer supply can be broken down into 3 main types, all of which have significant flaws. So the first type is, qualitative studies, and this is a majority of the safer supply research. A qualitative study, is basically just an interview with Vancouver-based drug users. That's highly subjective. That's not reliable. Then at the second level, you have quantitative studies, so that deals with crunching numbers. But all the data is self-reported. So you give out surveys to at-risk youth and drug users who then, use numerical scales to rate their well-being. So there's some level of objectivity there, but just not enough. And then the final piece is that you have studies which are using more, objective data, like a study that came out last year, which was authored by the London Intercommunity Health Centre, and they used Ontario's health administrative data. But the problem there is that the London Safer Supply Program, it doesn't just give out free hydromorphone. It also gives its patients access to wraparound supports, such as housing support and access to a specialized medical team. And there was no attempt within that study to show that positive outcomes came from the free hydromorphone versus all the other supports there. You would think that any reasonable would try to see which is which. That's not there. And
Wow.
that's a common.
We've got to go to break, Adam, but we will be right back.